Researchers are reporting that a new drug could benefit patients with early signs of Alzheimer's disease. Clinical trials have shown that patients given monthly injections of an antibody called aducanumab show dramatic reduction of protein clumps in the brain. They're largely responsible for the disease that causes dementia. But researchers now say that the new drug can significantly prevent such deposits and in turn prevent the likelihood of the disease developing any further. Well, Sourav Roy joins me now in the studio with more on this. Sourav, just tell us exactly what this new drug is and how it's going to help people suffering from Alzheimer's.
So this drug is almost like a magic pill for people suffering from Alzheimer's. What exactly happens with people with dementia and Alzheimer's is that the synaptic junctions, or the points where the nerves and the brain cells within the brain join, they stop talking to each other. There's a blockage because there's protein that's deposited all around it and over it. And because of the protein lumps, wherever these joints are, there's a failure in communication within the brain itself, and therefore people forget and people are unable to carry out certain motor skills as well. But this drug goes and specifically wipes out all the protein lumps and once again makes it working again. It's almost like, you know, a very complicated traffic light system inside your brain. So while it is red in one part of the brain, it might be green in the other part of the brain because there are different signals passing from the nerves in that part of the brain. For all of them to be talking to each other, it has to be a perfectly smooth system, and there has to be no protein deposits anywhere. And this drug does that wonderful job of cleaning away the proteins.
So how big a breakthrough? It sounds fantastic, sounds fascinating. How big a breakthrough is it in the battle against dementia?
It's a huge breakthrough because for the last 25 years, there have been about 400 to 500 different clinical trials of drugs. They've all been unsuccessful, primarily because of the reason that it's all inside the brain. And you need to have a chemical that goes and clears off only that bit that you don't want. And that's complicated to do or achieve within the brain because the brain has tons of other chemicals and hormones and so many other processes taking place. You don't want the chemicals to go and affect a certain motor skill or a certain cognitive ability of the brain. You want it to go and target only those specific points. So it's a target delivery specific drug, which I think is a great breakthrough. And this is going to help people with dementia. This is going to help people who are aging, and this is going to put an end to the disorders that comes through along with dementia, such as cognitive failures and motor skill failures.
Okay, Sourav, thank you very much.